All right, hello everybody. This is going to be part one of a core stability presentation that I have going. So the purpose of this is going to be to give you some anatomical overview of the core, and then we'll get into some of the function of what the core region actually does and is supposed to do during physical activity, and in this case, athletics. And then we'll talk about some rehabilitative exercises that I usually will go through with you, but I mean, certainly some that you can do at home or on the field or during a training site of wherever you're at. And then even the advancement of some of the rehab exercises to make them into more of a conditioning, injury prevention type exercise. All right. So moving forward, I'll try and keep these sections into maybe like 5 to 7 minute sections, so that way you can reference them from time to time. But I don't know exactly how many sections it'll be quite yet. So moving forward, so we have our anatomy. Anatomy is broken into two main parts: our structural anatomy and our functional anatomy, or our gross anatomy and our functional anatomy. So if you remember, gross anatomy is structure. Okay, that's the physical parts of, in this case, the core region. It's the muscles, the tendons, bones, cartilage, fascia, things that hold um, everything together. And then the opposite of that will be the functional anatomy, which is actually those structures either in motion or producing force, stabilizing, dispersing forces, things of that nature, which we'll get into in the second part of this video series. But just remember that gross anatomy is structure, functional anatomy is action anatomy, as I kind of call it. So this first slide here, it shows the core as most people think of it. We've got our rectus abdominis muscle here. All right. We've got our external obliques on the outside, our internal obliques running this way in between, and then the transverse abdominis, which is an important muscle that I'll get to in a minute, wrapping around the front. So the core region is broken into five kind of complexes. The first one I just showed you is the abdominal group. The transverse abdominis is that core region weightlifting belt, if you will. It's important to kind of train that properly and have it activate when it needs to stabilize the spine, create a foundation for forces to be produced, and strength and everything comes from that muscle, which is the transverse abdominis. The next one is the rectus abdominis. From the picture I showed you, that's kind of like the six-pack muscle. That's the one that you can kind of see those striations in. And then the other two, the external obliques and the internal obliques, are commonly referred to as a group of muscles, which when we get to the function, we'll kind of get into that, how they can produce rotations, stabilize, anti-rotation type exercises. The next complex would be opposite of that. It's the posterior lumbopelvic hip complex. It's located on the low back. It's the main three muscles there: the iliopsoas muscle, the quadratus lumborum, and the erector spinae. Just a little note about these is the iliopsoas, as I'll show you in a minute, is two different muscles that kind of comes together as one, and it functions as one. So we just call it the iliopsoas. The quadratus lumborum is a unique muscle just in what its responsibilities are, and I'll show you that. And then the erector spinae are three or many, but three main type of little muscles that make up the primary movers for trunk extension and things like that. So here we have the quadratus lumborum, and you can see it goes from the top of the pelvis obliquely or diagonally to the lumbar spine. So that's going to be an important not only stabilizer but mover, and a lot of rotational sports, the baseball, softball, lacrosses, throwing sports, racket sports, will put a lot of strain on that muscle, and a lot of times your low back discomfort can come from that muscle in particular. Here's our erector spinae group. and you can see how it's kind of many muscles that kind of all do the same motion there. And then here's the iliopsoas, which is here is the actual iliacus muscle inside the pelvis. And then here's the psoas coming up to the spine. And so together it acts as one to be a really powerful hip flexor. So moving on, we got four more complexes, but the next two would be the anterior leg complex, which is the quadricep group. Those are the muscle names: the rectus femoris, vastus lateralis, vastus intermedialis, vastus medialis, and sartorius. Opposite of that, we have our posterior leg complex, which is the hamstring muscle group that many of you are familiar with. So here we have our rectus femoris muscle. It does hip flexion, knee extension. Underneath this is the vastus intermedialis, so you can't see it. The vastus lateralis is on the outside of the leg, and the vastus medialis is right here. And moving over here, highlighted is the sartorius that wraps over the top. Okay. Here's the hamstring muscle group. We've got our semimembranosus, our semitendinosus in the middle, and our biceps femoris on the outside. The inner leg or medial leg complex is the adductor muscles. We've got our pectineus, adductor longus, adductor magnus, adductor brevis, and gracilis. Those muscles kind of are made up of as like the groin muscles. They move the leg from the outside towards the midline. And then our gluteal complex, which the main three there are the glute max, the glute medius, and the glute minimus. We've got here we've got the adductor longus, adductor brevis. Okay. Our adductor magnus is right here in this section. We've got pectineus right up here. And then gracilis is the long, thin muscle going down that way. Here on the next slide, we've got our glute max, gluteus maximus. Our glute medius is right up here. And then if you take these two muscles away, you can see the glute minimus, gluteus minimus right here. It's more of a stabilizer muscle than the other two. So anatomy recap. The gross anatomy recap, I should say, is, remember, structural. Okay, so gross anatomy structure. This is where sometimes genetic predispositions come into play. Someone that's 6'7" versus 5'7" versus 4'7" would have different, length to tension ratios and things like that nature. We won't get into too much of that. But just realize that this is where the saying, like, everybody's different, comes into play. And, holding a regular plank might be easy for somebody and extremely difficult for someone else with the same level of conditioning, the same level of training and things of that nature. Another term, tissue approximation. When you're dealing with structure, simply means that there's something in the way or blocking that range of motion, so you can't get a full range of motion. An example of this would be someone with visceral adipose, so stomach fat, and has difficulty doing a full sit-up where, because their skin and their adipose actually gets in the way of completing the full range of motion, elbows to knees. So things like that are known as tissue approximation. But the main selling point that I want to get across to you guys in this part is the core region or the core complex is more than just the abdominal muscles. Okay. It's there. Now you can read it. The core region is more than just the abdominal muscles. I mean, everyone always thinks of it as, just the abdominal region, but realize that there's way more to it. We've got the posterior complex opposite of it. You've got then the quads and the hamstring group, the inner leg and the glute complex as well. All right. So we'll get into the function anatomy next in part 2.